here's to your good health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center. This show is for you, by you, and about you. It's all about your information and learning what you need to learn about taking care of your body and taking care of your good health. And this is a community-sponsored program by WHIG-TV. They are committed to bringing all sorts of information to their viewing audience, from politics to church to health to way back when. So it's a privilege and an honor to be here with you tonight. It's a privilege and an honor to work here, and I've been doing this for, 8 or 9 years. I can't keep track, but it's been a journey. It's been good. I appreciate the opportunity. So tonight we're going to talk about some common maladies that we all experience at one point or another. Shoulder problems, knee problems, back problems, back pain, when you go to the doctor, who should treat you, physical therapy, a chiropractic, when would you need a neurosurgeon or a back surgeon. You know, there's all sorts of questions, and hopefully I can give you a few answers. So this is October 5th, 2022. I am live tonight. If you want to give me a call, that would be awesome. My number is 907-1111. I had to think. I've only been saying it for 9 years, so why would I remember tonight, right? But anyway, I just thought that, you know, I work in a family practice, and so I see a lot of shoulders, knees, backs, and I myself have had some issues with my feet. I'm like, what in the world? My feet were aching like a toothache. They just ached all the time. My right foot was worse than my left, and I could hardly walk, and when I did, I kind of hobbled. And we went to Hawaii, and we walked 3 or 4 miles every day. So at first I thought, well, it was from all that walking, because I wasn't used to that much, that frequent. But it just got worse and worse and worse. So I asked my provider if I could get x-rays of my feet, because I want to know what's going on. Do I have to go to a podiatrist, a special foot doctor? Do I need to go to the Good Feet store? Do I need inserts? I don't know, you know. All I know is my feet hurt. And I thought maybe it was arthritis. I do have some arthritis, and the feet seem to not ache quite as bad when I got up and moved. And so that's a pretty good sign of arthritis. If you can, you know, you wake up stiff and sore and you start moving around, and then you limber up and you can go on. But really, the pain didn't go away. It would alleviate some, it would minimize some, but, and you know, I'm not a big person on taking pain medicine. I prescribe it every day and tell people to treat their pain, and, you know, us nurses, we're the worst patients there are. So anyway, I had my feet x-rayed, and I have bone spurs on both heels. So I went, well, I guess maybe, you know, there's like 4 things you can do for bone spurs in your heels. Live with it. Well, I've been living with it for the right foot for about 2 months, and the left foot for the last 2 or 3 weeks. So that I didn't really like that option. Can take some non-steroidal anti-inflammatories like Aleve or ibuprofen. And I have taken some of that, and it does relieve the pain, but it, you know, obviously comes back. Getting injections in your heel, a steroid injection like they would put in your knee or your shoulder. And that wasn't too palatable to me. That sounds like it hurts. And then the other one would be surgery. And I definitely did not want surgery. I knew that was absolutely off the list. So, of course, the provider that injects heels is on vacation this week, so that wasn't an option. I did talk to one other provider who she doesn't do heels, but she does plantar fasciitis, but she said, she didn't think that would work. So that didn't go anywhere. And of course, today they are a little bit better. So I know that I've had a bone spur in my right heel for 35 years, for a long, long, long time. And I can honestly say that this is the third flare-up I have had in all those years. So I really can't complain. But it really kind of scared me because before I knew what it was, because I thought, my feet are my livelihood. I have to walk every day. I have to walk from one exam room to another. I have to stand on my feet. And so that was really bothering me. And I like to walk. That's my preferred exercise, is just walking around. I love to walk outside. It's so cool now. I can walk down and see the goats. I can walk through a path in the woods. And it's peaceful to me, and it's serene to me, and it's calming to me. So I like to do those things, and I thought, what if I can't walk anymore? And then I'm pretty vain about my shoes. I love shoes, and I get cute shoes, and I told my provider, I said, wearing tennis shoes does make it feel a little bit better, but there is no way I'm going to work in my cute outfits and wearing tennis shoes. That's just the vanity in me. I'll be perfectly honest. So after I had decided I would get the injections in my heels and couldn't find anybody right away, I thought, okay. But they're starting to get better. They don't hurt as bad. They don't ache as much. I would come home from work and sit in my recliner and put the foot up, and it would just ache and ache and ache, and I would cry. It would hurt so bad. Of course, did I get up and get some Tylenol or some ibuprofen? No, I didn't do that, so I deserved to cry, I guess. But anyway, so I guess I say all of that to say this. Number one, if you have a bone spur, there are things you can do. There are some stretching exercises you can do. And you can fill a water bottle, about half full, put it in the freezer and freeze it, so then you can ice your foot. You can put the, I don't know if you can see, put the roller bottle or the bottle on the floor and put your foot over it, and you can roll it like that. And that will it will ice it. And ice is good for pain. So I've started practicing what I preach, which is amazing for me, and they are a little bit better. So I'm hoping that when the provider comes back next week, I won't have to have him inject my heels, but I will if it doesn't get better, because I've got too much to do and too many things going on to have to sit. And I am not a sitter. I can only sit for so long, and I've got to get up and go. I've got to get up and do. I cannot sit. My husband can sit for hours in front of that computer, and I guess maybe the reason I can is because I do sit a lot at work. And so when I'm off work, I can sit and watch 30 minutes of TV, then I got to get up and empty the dishwasher, or I've got to get up and sweep the kitchen floor, or I've got to get up and do this, get up and do that. It's who I am. It's how I was built. So anyway, that's my tale of woe for bone spurs, or heel spurs. But you can get bone spurs. And it's really, a spur is an overgrowth of bone. And you can get it in your shoulders, you can get it in your hip joints, you can get it in your spine. And that's a lot of times when people have surgery. I don't know so much on your feet, but they will shave those bone spurs off of your shoulders or your hips and that kind of thing, and your spine. So it's very common to have a bone spur. We've got them, and there's two schools of thought with bone spurs. One is some providers do not believe that bone spurs can cause the pain that people complain of in their foot. Some providers think that that's more plantar fasciitis, which is inflammation of the plantar fascia, which is part of your foot. And so I've always been taught that bone spurs can hurt, and they can hurt in any part of your foot. They can hurt in the top part of your foot. You know, there's something called referred pain. So you've got, the pain is really in this finger, but you feel it over here in your wrist. That's called referred pain. And so I talked to 2 different providers at work, both medical doctors, and one said there's no way that bone spurs can cause that kind of problem. It's got to be plantar fasciitis. The other one said, I don't know, but I would tend to believe that those bone spurs cause pain. So there you go. Got this school of thought and this school of thought. And I said to one of the doctors I talked to, I said, well, I guess I'll just keep treating people the way I have. So very few come back after they complain to me about it, and I've given them, you know, the stretching exercises and the icing idea, and the I usually give like naproxen, which is a real strong dose of Aleve. And I don't have too many that call back and say, I've got to go here, or I've got to have this, or refer me to this. So I don't know if it just goes away on its own, or if they feel better, or what. But anyway, so if you've got bone spurs, especially if you've got heel spurs, they can hurt. But there are exercises, you can do stretching exercises that help, and then the icing, and then the naproxen. So that's my tale of woe for this week, as I've been hobbling along the office. Hard to get from point A to point B. But we're getting there, so that's all right. So I thought I would talk about, you know, there's something called bursitis. And every joint in our body has what we call a bursa, and it's a fluid-filled sac that helps to cushion the joint. That sac can get inflamed, and that's called bursitis. So they cushion the bones, tendons, and muscles near your joints, and bursitis occurs when the bursa becomes inflamed. The most common locations for bursitis are the shoulder, elbow, and hip. But you can also have bursitis in your knee, heel, and the base of your big toe. Bursitis often occurs near joints that perform frequent, repetitive motion. Treatment typically involves resting the affected joint and protecting it from further trauma. In most cases, bursitis pain goes away within a few weeks with proper treatment, but recurrent flare-ups are common. So if you have bursitis, the affected joint might feel achy or stiff, and my feet felt achy and stiff, but I don't think it was bursitis. Hurt more when you move it or press on it. If you've ever had tennis elbow, people will say, I've got this pain in my elbow, and I can go up to them and point and press right exactly where it is. Yeah, that's exactly where it is. Yeah, because that's called tennis elbow or golfer's elbow. So when you press on it, it hurts more. They can, the joints can look red and swollen. And so those are, you know, the symptoms of it. Causes are repetitive motions, as we said. So, you know, you have a lot of people that do a lot of typing, and they're on their computers all day, and so there's a lot of issues with that, like carpal tunnel syndrome and just joint pain. But the most common are the repetitive motions that put pressure on the bursa around a joint. So throwing a baseball, lifting something over your head repeatedly, leaning on your elbows for a long period of time, extensive kneeling for tasks such as carpet laying or scrubbing floors. And then it can be caused by trauma to the affected area, inflammatory arthritis such as rheumatoid arthritis, gout, infection. So some of the risk factors are your age. You know, the older we get, bursitis is much more common. occupation or hobbies. If your work or your hobby requires repetitive motion or pressure on a particular bursa, your risk of developing bursitis increases. That only makes sense, right? Examples include carpet laying, tile setting, gardening, painting, and playing a musical instrument. Like I said, the typing all day, people's fingers get really sore. Playing the piano, because again, you're using your hands and stretching those fingers and that kind of thing. So, not all types of bursitis can be prevented, but you want to reduce your risk and the severity of flare-ups by changing the way you do certain tasks. So if you're a carpet layer, use kneeling pads. That helps reduce the pressure on your knees, and it might help. Lifting properly, bend your knees when you lift. Don't bend your back. You bend your knees and you use the thigh muscles to push up, and that's how you pick up things. And so if you don't do it that way and you bend over, then you're going to put more pressure on the bursa in your hips. Wheeling heavy loads instead of carrying heavy loads, which can put stress on the bursa in your shoulders. Use a dolly or a wheeled cart instead, like a wheelbarrow. Taking frequent breaks. I know that a lot of people, they get going and they do something. I've got people in my family that they are not going to quit until the task is done. Me, I work for an hour, I go off and do something else. I think it's the ADD in me. My brain can't stay focused. But, so, you need to take a break, and you need to just get away, and you need to rest your hands or rest your shoulders. Maintaining a healthy weight, of course. The more weight we have on, the more pressure on our knees, the more pressure on our hips. So if we can, have less weight, that helps with the stress on your joints. And strengthening your muscles. Muscle strengthening is a big help. And that, you do that with exercise, of course. And then, warming up. If you're going to be out there doing something, you need to warm up and stretch those muscles to protect your joints from injury. So that's kind of that in a nutshell for bursitis. I think that's it for bursitis. And then there's tendonitis. And our bones are attached to our muscles with tendons. And tendonitis is an inflammation or irritation of a tendon, and that's the thick fibrous cord that attaches muscles to bone. This condition can cause pain and tenderness just outside a joint. So fingers, elbows, hips, knees, toes, and tendonitis can affect any of your tendons, but it's most common around your shoulders, elbows, wrists, knees, and heels. So, common name for various tendonitis problems are tennis elbow, golfer's elbow, pitcher's elbow, swimmer's shoulder, and jumper's knee. So, if you get exercise by jumping rope, then you might have some of that. Most tendonitis is like bursitis. It's treated with rest, physical therapy, medications to reduce the pain. If tendonitis is severe, it can lead to the rupture of a tendon, and you might have to have surgery. So we're going to stop right there and take our first break, and then when we come back, we will talk more about tendonitis, what it does, where it hurts, and what we do to fix it. So don't go away. We'll be right back after a word from our sponsors.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Koss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Well, hi there. I'm back. This is Linda Prezioso. This is Here's Your Good Health. We've talked about bursitis, and that is it's a fluid-filled sac that is in our joints, and it helps to cushion the joints and cushion the muscles, and that can get inflamed and become painful. That is called bursitis. Then we had moved on to tendonitis, which that's an inflammation or irritation of a tendon, which is the thick fibrous cord that attaches muscle to bone. And that's also pain, and it causes pain, tenderness, and that's just outside the joint. So bursa is more in the joint, and tendonitis would be more outside of the joint. And so we talked about various common problems, which is tennis elbow, golfer's elbow, pitcher's shoulder, swimmer's shoulder, or jumper's knee. So I don't know that we have a whole lot of jumpers, but you never know. And as I pulled up to Wesleyan this evening, because the studio is on the Wesleyan campus, and they're playing football, I'm thinking, well, they probably have a lot of injuries. Just that they don't necessarily jump, but I've seen them practice where they have all these tires lined up, and they step in one and another and kind of hop through all those tires. So that would be something that could probably cause some tendonitis too. Of course, these guys are young, and this kind of stuff happens more often as we age. It doesn't happen too often when you're young, but anything can happen anytime. So the symptoms of tendonitis are pain, which is often described as a dull ache, especially when moving the affected limb or joint. Tenderness, and you can have some swelling, not necessarily, but you can have. So, tendonitis is mostly self-care. If you rest it and ice it and take some non-steroidal anti-inflammatories, you might be able to get away with not seeing the doctor. But tendonitis can also be caused by a sudden injury. and then or it can stem from repetition. Most people develop tendonitis because their jobs or hobbies involve repetitive motions, which put stress on the tendons. So we've got to learn proper techniques, on how to do those, to perform those repetitive movements, and because if we don't, we overload that tendon, and that's what causes the problem. So I had tendonitis first in my tennis elbow, when I first worked in the emergency room years ago, and that was before the hospital even, I'm really dating myself now, but that was before the hospital had electronic charting. Everything was written by hand, and so I was writing 12 hours a day, on my shift, and I got tendonitis, and it hurts. Boy, it hurts. And so I had various PAs that worked there. Those were in the days when you could get your hands on any drugs, and so they get a little lidocaine and get a little Kenalog, and they'd inject my elbow, and it helped. It hurts to get those joints injected, I tell you, because you're putting stuff in there that doesn't really belong, which puts pressure in that joint, and that can cause a little pain. But that worked, and it helped for a couple, 3-4 weeks, right back. And so I had 2 or 3 injections, and it would last for a little while and would come back. And I was working with a doctor that worked in the ER, and he was Malaysian, from Malaysia, but he moved here from Toronto. Can you imagine living in Toronto and coming to Rocky Mount? Other than the weather, why? But anyway, so, and when he was in Toronto, he had an acupuncture clinic. And so I was talking to him one day, and he said, well, let's try some acupuncture. I said, okay. And so acupuncture, is a small little needles, and we've done this before. Most all of the chiropractors, or maybe all of the chiropractors here in town, do acupuncture, and you follow along a nerve path where the pain is, and then you put these little needles in, and then you twist them periodically, and that stimulates that nerve. And the theory is that you're going to go by that nerve path, and you're going to stimulate the nerve, and that's going to stimulate the area, and it's going to help it. And guess what? It helped it. Two times of acupuncture for tendonitis, and I didn't have it anymore. And I went for probably 20 years without having it again. So I've had to go back to a chiropractor a couple times for acupuncture. I had some when I had some back pain, and I think I did have another bout of tendonitis in my elbow. So, that I found out on my own. You're not going to see that probably in medical books. Now, any chiropractor would tell you that, and anybody who knows anything about Chinese medicine would tell you that probably. But, the standard American medicine, they don't really know about that. And, I'm always about natural. I'm always looking for some way to get things done without putting drugs in our body. So acupuncture for me is, a dream, because that's what I want. So anyway, that's what I did for tennis elbow, and I would, if you've got that and you're not getting relief from the standard care that your doctor has been telling you, and you might get relief right away. I don't know. But if you don't, can you consider acupuncture? And we've had Dr. Alan Bolin on here from Hammer Chiropractic, and he has actually performed acupuncture on me on the show. And so I think he told me he doesn't do too much of it anymore, but there is a Dr. Patel who works in his office, and she does a lot of it. That's kind of what her focus is. And I think the other chiropractors kind of let her do that, and they do the manipulation and that kind of thing. But so the risk factors are about the same for tendonitis as they are for bursitis, and that is age. Everything happens when you age. Work in particular jobs or participating in certain sports. I mean, if you're a baseball player, you're throwing that baseball, either you're pitching it and throwing it a lot, or you're working one of the bases or out in the left or right field, and you are catching those balls and throwing them. So, and a lot of our kids play baseball. I've got 3 grandchildren, and 2 girls in softball and 2 boys in baseball, 4 grandchildren. Then I've got a girl in soccer, and then so I'm always on a ball field. And my poor kids yesterday, I had to go to a wake after work, and so I wasn't really available, but they had 4 kids going in 4 directions. They had one playing softball in Red Oak, one playing baseball in Nashville and Glover Park, one playing baseball in Spring Hope, and then they had one that was on a field trip for school and had to get picked up. So I had to go one place, my husband had to go to another, and then my son went one, and my daughter-in-law went one. So we were all over the county yesterday. But, so kids play ball, and this is ball season, football season, soccer season. Baseball, I guess, is all year round. It's not just a spring sport anymore. So, as we age, too many birthdays, that's what I tell my patients, you have had too many birthdays, but we don't like the alternative. So we've got to learn to live with the age, and we've got to learn to live how to take care of our parts as they wear out. So our tendons become less flexible as we age. And then, your occupation, repetitive movement, awkward positions, frequent overhead reaching, vibration, forceful exertion, all those are risk factors. And then, as I said, the sports, baseball, basketball, bowling, golf, running, swimming, tennis. And then you really, I think probably tendonitis is a little bit more serious than bursitis. I think bursitis maybe hurts a little bit more. I don't know for sure. But tendonitis, if it's not taken care of, you can rupture your tendon. And that's a pretty serious problem. And that can even, result in you. I got the hiccups now. It's just water, I promise. That can rupture, and that can be a big problem. You might have to really baby it and treat it gently, or you maybe have to have surgery. I had a friend that he was on Cipro, and Cipro is an antibiotic, and you use that for infections, and he was on Cipro for, I don't remember what for, but he was walking up his back deck, and all of a sudden his foot didn't work, and he had ruptured his Achilles tendon. And Cipro is can be a serious side effect of that particular drug, and they think that's what happened. And we had to take him to the ER, and I went with his wife and him, and he ended up having to have surgery on his tendon, and it's never been the same. Of course, whenever we break something or something is repaired, or a broken ankle is fixed, it's never quite the same as when God made it. So he still has some problems with that, but it doesn't slow him down. Excuse me. If anybody has any great sleep ideas, as much as I preach about exercise and eating right, and I do for the most part, I'm a terrible sleeper. And I cannot sleep for more than 2 or 3 hours at a time. This morning I woke up again. I went to bed. I always go to bed about 9 and usually fall asleep between 9:30 and 10. I lay in my bed and read. I have a book on my phone that I read until I get tired and then close my eyes. So I'll say I went to bed to sleep at 9:30. I don't know, 9:30, 10. Then I was up at 12. Got up, went to the bathroom. I get hot and I have to throw the covers off. And then I went to the bathroom and got back in bed and went back to sleep. Then I woke up at 3:30. Could not go back to sleep. Laid in that bed for 45 minutes with, no lights on and cool room and dark, and I just couldn't go back to sleep. I do take something to help me sleep. I take something called trazodone, and that will help, but it only keeps me asleep for 2 or 3 hours. And then when it's 3:30 and I have to get up at 5:30, then I don't take anything because I'm afraid that I'll have a hangover from whatever it is I take, Benadryl or whatever. And so, anyway, I don't even know how I got on sleeping. Oh, because I was yawning. But anyway, so I need to sleep. I hope I can sleep tonight. I don't know. I'm going to talk to my doctor. I see her on Friday and see about getting something, some plan, something. I don't really like the idea of sleeping pills, but I really do want to be able to sleep. So we'll see. But anyway, all right. So prevention of tendonitis. Ease up on your excessive stress on your tendons. If you have pain with a particular exercise, stop and rest. Mix it up. If one exercise or activity causes you particular persistent pain, try something else. Cross-training can help you mix up an impact loading exercise, running, lower impact exercise, biking, swimming. Some people say brisk walk and then regular walk and then run and brisk walk. So you just got to figure out what works for you. And then improve your technique. Whatever you're doing, you could be setting yourself up for problems. So, have somebody watch you and see when you're throwing a ball or whatever. Are you sitting properly? Are you holding your neck properly? Or you can, if you're going to start, start an exercise program, you might want to get a trainer for a couple times so you learn how to do things properly. You always have to stretch before you exercise and after you exercise. Got to have good workplace ergonomics. That's a big thing. I hear people saying, I'm hunched over because I'm on the computer. So, or my chair is uncomfortable and my back hurts. So it's important that you have the right chair, that your computer's at the right height. I've got one guy that works with me and he's real tall, and so he's got a big book about that thick, and he puts his keyboard on top of that, and that's how he types because that's better for his back. So those are some things about tendonitis. Now we're going to talk about a few various injuries, couple for shoulder injuries, knees, and backs. And back pain is probably one of the most common problems that people come to the doctor for. So, and then I guess I'm thinking about shoulders because my son fell at work and he had to have an MRI. He hurt his shoulder and he hurt his knee, and they think he tore his rotator cuff, and he's probably going to have surgery, and he's on disability and he's bored to tears. He doesn't know what to do with himself. So say a little prayer for him. But anyway, it's time for our next break. So when we come back, we'll talk about these other injuries that I pulled up to talk about tonight. Don't go away. We'll be right back.
Come celebrate our 20th anniversary with us and see how we can help with your hearing challenges and hearing care. To celebrate this monumental occasion, when you buy a pair of Livio 1600 series hearing aids or higher, you get one hearing aid for free. because it helps to have a spare of equal or lesser value. We know how inconvenient it is to have your hearing aids serviced, maintained, and repaired without a spare. As a community provider, we are focused on individualized care as personalized as your fingerprint. We build relationships with our patients and believe that is the only way to provide the quality of service that has kept us in business for more than 20 years. We have grown and stood the test of time while embracing technological advances and innovations in our industry. We couldn't do it without all of you.
You don't know what anybody can do for you until you have a problem. And when you have a problem, is how the person works through that problem that makes them effective, makes them beneficial in your life. I get involved in a lot of activities at our church. And with the music and things that are going on, I'm going to my noisy setting quite a few times, and then depending upon who's speaking, I may be going to what they call a theater setting, which is a higher level, and so you have to negotiate. You only have, in my case, I only have like 3 different levels now. She does have some technology. We have some different volume controls. I don't use that, and I have to work with her, and rather than having to come back to the office, it's easier for me to call her wherever she's at, and we'll set us up a time, and then she will readjust my hearing aids over the telephone, which works real good. And I've used that quite frequently. But usually once you get set up, you don't typically have to change much. And a lot of times people don't want to go through the pain of the setup process, but if you don't spend the time in the setup process, you're not going to have the long-term results.
We are thankful to our faithful customers and look forward to many more years of service to our community.
I would say patients, they say it for us. You know, they refer people to us all the time, and they're not going to refer if they're not happy with you. If they don't think you're going to take care of their friend or their family member, they're going to shut right up. They're not going to say anything. And I've built my business on 75% referrals.
We offer convenient financing, layaway, and many pay options to ensure that our customers have comfortable experience getting quality equipment, reliable service you can depend on, and the product that fits both your physical and financial needs. Please visit our website, downeasthearingcare.com. Don't miss out. Schedule your appointment today. This month, we would like to invite you to our VIP 20th Anniversary Open House Hearing Healthcare event. During this event, we are offering 1 free Livio RIC hearing aid with the purchase of 2 Livio MRIC devices per person. Receive an expert, no-obligation hearing consultation and free product demonstration. This limited-time offer is available at our local hearing clinics. Get answers to all hearing-related questions. You can reach our convenient locations in Knightdale at 919-500-7455 or Rocky Mount at 252-378-2018.
All right, I'm back. This is Here's Your Good Health. My name is Linda Preziosa. I'm a nurse practitioner at Family Medical Center. And we're going to talk about a rotator cuff injury. I know probably everybody's heard of that term. And the rotator cuff is a group of muscles and tendons that surround the shoulder joint, keeping the head of the upper arm bone firmly within the shallow socket of the shoulder. A rotator cuff injury can cause a dull ache in the shoulder that worsens at night. Rotator cuff injuries are common and increase with age. Everything increases with age. Praise God, we're having another day. These injuries may occur earlier in people who have jobs that require repeatedly performing overhead motions, such as painters or carpenters. And my son, the one that's got the hurt shoulder and probably has the rotator cuff, he is a truck driver for Cisco Foods. And so he has to pick up big pallets of food and get them on the dolly and, and take them from his truck to restaurants. So that's a lot of heavy lifting and that kind of thing. So physical therapy can improve flexibility and strengthen the muscles surrounding the shoulder joint. But you've got to have a licensed physical therapist. You can't go and read something on YouTube and do it yourself. You've got to have a licensed physical therapist who has been to school, who knows all that. And he can teach you the exercises, but you've got to see what he or she has to do first. So sometimes the physical therapy will help. And sometimes that's because you can also have a rotator cuff impingement, and there's something pressing, like the swollen tendon or something is pressing on the muscle, and that causes the pain. And the symptoms of a rotator cuff are deep, dull ache in the shoulder. It disturbs your sleep, makes it difficult to comb your hair or reach behind your back. You can't go like this. You might be able to go like that. That's about it. And you can have some arm weakness. So you've got to go and see a doctor, and you depending upon what it is, you're going to have surgery to repair it. If it's a tear, they'll repair it. They're most often caused by progressive wear and tear of the tendon tissue over time. But it can happen during a fall or an accident. And that's what happened. My son fell. So you can have some complications of permanent damage, but for the most part, you can have the surgery and you'll do just fine. So now we're going to talk about some weightlifting. There's 5 common shoulder injuries from weightlifting. And, these guys that bench press or push up they've got these huge, big weights that probably do 150 pounds. I don't know. I can't hardly do 10. But anyway, so some of the common problems from weightlifting, and mostly are shoulders, and you can have biceps tendonitis. Your biceps are these muscles right here, and of course we said that spilling water all over, that the tendons is what attaches the muscle to the bone, and that can feel like a dull ache, and you can have inflammation of the fluid-filled sac. That's the bursitis. And then we have the rotator cuff tendonitis, which is an inflammation of the rotator cuff tendon, which is painful. You can have some sprains and strains, and they can be, they can have a tear in that as well. So that's just some of the more common ones from weightlifting and that kind of thing. So let's move on to knee pain. Everybody's got a pain in their knee, and everybody comes to the doctor, and everybody wants an x-ray, and everybody knows that it's just the worst thing ever. And knee pain hurts. I'm not about to say that it doesn't. I will tell you that I have near bone on bone in both of my knees, but I take 2 products for knee pain. One is called Instaflex, Instaflex, and that they used to, when we had a GNC store, I would buy it there, but I don't, and then it might be sold somewhere here, like maybe Walgreens or something, I don't know. I just go ahead and go to Amazon and get mine. It's just easier. So I take Instaflex. I take that every day for knee health, and it's all full of natural ingredients. And then the other thing I take is turmeric. And turmeric, that's the spice that we use in like Indian food, and you probably all of us have it in our cupboards, but turmeric is a natural anti-inflammatory, and so they make turmeric pills or curcumin pills, and so I take that every day. And so my knees very rarely hurt, but I should have went into this with knee buckling, because my right knee is starting to buckle, and that is, you might get out of the car and push up on one leg, and then it kind of gives out a little bit, and that's called buckling, and that's a weakness in the tendon. So I got to talk to my physical therapy friend and see what I have to do about that. But symptoms in your knee are swelling and stiffness, redness, warmth to the touch, weakness or instability, popping or crunching noises, that's called crepitus, or an inability to fully straighten the knee. So if you can't bear weight on your knee, or you feel as if your knee is unstable and going to give out, if you have a lot of knee swelling, if you're unable to flex your knee or extend your knee, if you have an obvious deformity, if you have fever in addition to redness and swelling in your knee, or if you have severe knee pain, you need to see a doctor right away. A lot of our problems are knee bursitis. We can have something called Baker's cyst, and that is a cyst that forms in the posterior, the back part of your knee, and that can be pretty painful. There's nothing we really do for it, but it just has to go away on its own. You can have a ACL, that's the anterior cruciate ligament. It's one of the 4 ligaments that connect your shin bone to your thigh bone. The ACL injury is particularly common in people who play basketball, soccer, or other sports that require sudden changes in direction. If you're running this way and then the ball's over there and you swing like that and try to get the ball in your knee, your feet can stay and your knee goes, and that's what can cause that. Of course, if your knee is broken, that can happen if you fall or if you have an auto accident. A torn meniscus, and the meniscus is the tough rubbery cartilage that acts as a shock absorber between your shin bone and your thigh bone. And it can be torn as well if you suddenly twist your knee while bearing weight on it. Knee bursitis, we talked about bursitis, and you certainly can have that in your knees. And then you can have patellar tendinitis. Now patella, that's the kneecap. And that can get irritated, inflamed, and that happens when you run, or if you're kicking and running and jumping all at the same time. Runners, skiers, cyclists, and those involved in jumping sports may develop those problems. So a lot of time your knee pain, these are all certainly possible injuries, and none of these are anything that I would treat. If you come to me and you have knee pain, if you've hurt yourself in any way, I certainly will get an x-ray. A lot of people want to have an x-ray even if they haven't hurt themselves, and I comply and I let them have that x-ray. A lot of times it's aging, a little bit of arthritis called degenerative joint disease. We can have some bone spurs in our knee. So a lot of times it's that. And so the treatment for kind of those more simple problems with the knee would be non-steroidal anti-inflammatories, ice to the area. Icing helps with the pain. Physical therapy, because they will teach you how to build up your muscles around your knee so you don't have as much pressure on the joint. And so those are things that I can pretty much help you with. If you have some other problems like the fracture, the torn meniscus, most of those things have to be determined by an MRI. And if you've had this knee problem and you've done physical therapy and treated what we call conservative treatment, and your insurance is going to require that, people want to have an MRI, well, you've got to jump through hoops for an insurance company to pay for an MRI. And so those hoops include the nonsteroidal anti-inflammatory, the physical therapy. And if those things don't work, then you come back to me, and then I refer you to a knee surgeon, an orthopedic guy. We have several good knee surgeons here in town. We're blessed to have such highly skilled surgeons in our area, whether it's orthopedics or general surgery or even cardiac surgery. So I'm not going to go into some of the mechanical problems because that's a little bit too much. You know, we can have different types of arthritis in our knees. Osteoarthritis is what most of us have, and that's a degenerative arthritis. It's the most common, and it's usually from wear and tear. Then you can have rheumatoid arthritis, and that's a more debilitating form of arthritis. And it's an autoimmune condition that can affect any joint in your body, including knees. A lot of times you'll see people with deformed knuckles. That's usually rheumatoid arthritis. And that you have to see a rheumatologist for. Then there's gout. Gout is a form of arthritis, and that occurs when uric acid crystals build up in the joint. And we can treat that pretty easily at the office with something called, we test for the uric acid, and then we treat with, there's specific gout medicines that help a lot. You can have pseudo gout, and that's a false gout, and that is caused by calcium-containing crystals that develop in the joint fluid. Knees are the most common joint that's affected by pseudo gout. And of course, that has to be done by drawing out some fluid and testing it. And then you can have septic arthritis, and that can get to be pretty dicey. And sepsis is caused by infection, and you can have swelling and pain, and that can really deteriorate your bones, and it can be pretty serious. So we don't want to do anything about that. I mean, I don't want to do anything about that. We're going to send you probably to the hospital and get some IV antibiotics and that kind of thing. All right, it's time for us to say goodbye. Randy's here in the house, and he'll be coming and talking to you about I don't know what, because I forgot to ask him. And I will see you next week with more of Here's Good Health. Have a good evening. Good night.